Next speaker is Georgios Varotsis. He is an epidemiologist who has been working at the Uppsala University alongside the healthcare region in Uppsala during the past year with the framework of the project Crush COVID. And this is what he will talk to us about. So please.
Hi, can you hear me?
Yes.
And you can
we can
presentation. Yes, perfect. Okay. Well, thank you very much for inviting me over to this workshop. And let's jump right into it. So we will talk about the project Crush COVID and how we have been trying to foster data sharing regionally in Uppsala County. Yeah, first we will talk a bit about the project, then we go on with some ethical approvals that we needed to receive, and I will present a bit the type of data that we have, how we present them on the dashboard on the different platforms, and then how I think we checked some of the boxes of the FAIR principles, and to go on about the importance of sharing, especially for the COVID-19 data. So a little bit about the project. Crush COVID is a collaborative research initiative that is focused in Uppsala County. And what we are trying to do is to constantly monitor the virus temporal and spatial trends of the COVID-19 pandemic in order to be able to intervene in real time as soon as we suspect that there is a COVID-19 hotspot or outbreak. Behind Crush COVID, you will find a multidisciplinary team with researchers mainly coming from Uppsala University and Region Uppsala, as well as SLU and various other organizations. And before we go on and talk about how we collect data and how important it is to share the data, it's very important also to point out that Crush COVID has received a lot of ethical approvals coming from the Swedish Ethical Review Authority, because it is very important that we assure that the data that we collect and then afterwards when we share it, we do so responsibly and that we are ethically accountable for that, and that we absolutely minimize the risk of harm to the patients. And of course, we have to ensure that all the data collection, the data sharing has a beneficial outcome, that we serve a purpose. So a little bit about the data. We collect a lot of data from many different sources. It's always on a group level, on a postal code level. And we collect information on the number of calls to the 1177 line, which is a line where people call to report their symptoms. Also, we have the number of calls to the emergency line related to COVID-19 symptoms and emergencies. And we also collect a variety of data on the symptom reporting from the COVID symptom study, where users report their symptoms on a daily basis with regards to COVID-19. And we also monitor the viral load on the wastewater, and this is done by SLU. And this is coupled with aggregated anonymized data that we collect from Region Uppsala, and that is usually the number of tests, on the number of cases, hospitalizations, and the vaccination coverage, etc. And it's important to note that even though this is group level data, if a postal code has a very small population that would allow identification of a patient, we omit that from the statistics. So we try to protect the patients when we collect the data and we share the data. That's important to note. And then what we do with the data is we compile the different analyses and we offer some of the data to download on the dashboard. And the dashboard is simply a web page that we have built on the R software. And here you can see the welcome page. I'm pressing click, I hope it works. Yes. And you can see that, for example, we start with a speedometer where we presented the number of cases for the different municipalities, the test positivity, the number of tests. And then on the left side, you will see that there are different tabs where users can select any analysis they wish to look at. And we can see, for example, the table with where we rank the different municipalities and the city parts based on the number of cases, the test positivity, and the number of tests. And that gives us a different perspective on how the pandemic is developing within Uppsala County. Then we have, for example, vaccination coverage as statistics where we stratify, I'm sorry for the noise, where we stratify the vaccination coverage per age group and gender, and we color the number of people that took dose 1, dose 2, and dose 3 with different colors. And then we can select a different part of Uppsala County to see what's going on regionally. We also have a CDC map, which is pretty much a replication of what the ECDC is doing on a European level, only that we do it for Uppsala County. And then, as you can see, it's very interactive. People can see what's going on in the neighborhoods and go past in time, see the different weeks. And on the same tab, what we also have is different, people can download the data and description of the data and many more. I invite you to scan here to see the link of the dashboard and explore a bit yourself. It's a very nice environment. And also we upload some of the data on the COVID-19 portal. Shout out to Arnold from SciLifeLab for the help. And then thanks to this workshop, I had the chance to actually reflect on how much we check the different FAIR principles, because from the very beginning, Crash COVID, the goal was to share the data and to make them available to everyone. And we always wanted the data and the graphs and the statistics to be available and findable from people. So we set up the website, the dashboard, we put them up on the COVID-19 data portal. And we have also recently put up a lot of R scripts, data sets and data description on GitHub with extensive descriptions. And of course, our data had to be easily accessible, so no authentication required. We want to have downloadable material, and we plan to have the metadata staying after once the pandemic is over. In terms of interoperability and reusability, I think there's a lot of room for improvement. And of course, the FAIR principles, well, like for the vocabulary, whether it follows the FAIR principles, we haven't done it, but it's a good occasion to actually reflect on what can be done to improve data sharing. And why is it important to share all this information, especially in the COVID-19 pandemic? You will see here, this is the Uppsala County Council and their bi-weekly meetings where they share, they have been sharing our statistics and graphs. And based on our observations, they take important public health decisions. For example, based on our observations, there is a mobile testing unit, which is pretty much a bus that offers testing and contact tracing, has been deployed in different areas that we identified as possible outbreak hotspots. For example, in Alunda and Stenhagen, which are two regions in Uppsala County. And the bus was sent there based on the fact that we recognized as Crash COVID that there is very decreased testing, but at the same time an increased transmission. And as you can see here, this is the graph with the number of tests on the y-axis over time. And the weeks that the Region Uppsala sent the testing units, testing increased significantly in all these areas that we recognized as areas in need of testing. And of course, our data and reports have also guided communication strategies to tailor-make them based on in which area, which neighborhood needs more attention. And the two leaders of the project, namely Tove Fall and Mats Martinell, have constantly trying to inform the general public about our observations throughout the pandemic by being present in the press and giving important interviews. And it's also important to know that our data has been used a lot to more and more now to conduct research. You can see here there is a paper that's been prepared that has been investigating the inequalities in testing and how socioeconomic circumstances in Uppsala County have contributed to those inequalities. And we just submitted a paper with another team on predicting the outbreaks in time and space in Uppsala County. We have also participated by providing data to a hackathon where young researchers try to hack the pandemic. And there are many more projects coming up like reconstructing outbreaks using contact tracing data, validating non-pharmaceutical intervention and communication strategies. And all this is thanks to the fact that Crash COVID from the very beginning wants to be open to share data and also friendly when someone approaches to conduct research or is interested in the data to open even more and share even more data. And I think my time is almost over. So I would like to thank all our partners, and feel free to visit all these links and scan the QR code to visit the dashboard. And if you have any questions, you can contact me, and we can also talk now a bit if we have time. Thank you very much.
Thank you, Georgios. I think this dashboard is very impressive. Are there questions for Georgios? I have. I really like this dashboard, and clearly it's very good for humans. But how machine actionable do you think the data and
it's not machine actionable. It is when we put them on GitHub maybe, but there is a lot of room for improvement, and that's what I thought. We didn't really think as based on the FAIR principles when we first put up the data, and gradually by being less busy with the pandemic, we started thinking of other ways that we can make them more accessible. So I think that's a very good start to actually think how we can make them more machine accessible and operable so that research can be facilitated and open new channels. Yeah.
And my intention is not to put you on the spot, because I think you've done fantastic work here. So, yeah, we're not used to thinking about FAIR principles as a starting point usually. But do you think would it be possible for you to give an estimate how much extra work it would be for you to?
Oh, that's what I want to say, actually, that because we've been so busy monitoring the pandemic and trying to take public health decisions and promote things, we haven't been thinking a lot about the data sharing and how to improve it. So I think in order to set up the data sharing based on the FAIR principles, we will need someone working full-time for bits until it's set up. I think it's a lot of work to set it up, but once it's set up, it's just accessing the data, which is machine operable. But the problem has been that we've also been so busy with the pandemic that we haven't been able to make time for that. And now that we start to relax a bit, it's when we think about, okay, how can we make it actually work better, maybe for the next pandemic, so we can have machine operable data immediately and not once the storm is over, you know. So a lot of food for thought, and thank you also for that, because you made me think, how can we make it better in the future?
Then I have a really detailed question that is of an interest of mine. You said that you omitted patients from postcodes with too few inhabitants. What's your threshold? How few when do you omit? What's the threshold of number of inhabitants?
Usually it's anything under 300, and depending on how sensitive the 300 inhabitants and how sensitive the data is, we sometimes have omitted also if the inhabitants are more. But sometimes you have postal codes that have only 10 inhabitants. And there, if you have one patient or one vaccinated person, is a bit, okay, it's quite obvious who that person is. So we have a threshold of much higher than that, again, to protect sensitive data. And I think it's also important to keep in mind that it's not just about data sharing, but before that, you have to make sure that you're not causing a risk to anyone. So that's another thing that needs to be borne in mind when you want to share data. Make sure that it has been validated by an authority like the Swedish authority, and that you can share it freely, and what are the thresholds of sharing.
Thank you.
Thank you very much.